I'm Dr. Jim Odell, and I'm Chief of the Division of Rheumatology and Immunology here at University of Nebraska Medical Center. And in that regard, we are very proud of our national and international role in the treatment of rheumatoid arthritis and finding better treatments for our patients. Back in the late 80s, I decided that what we needed to do is do better clinical trials in rheumatoid arthritis. There really weren't a lot of therapies for rheumatoid arthritis at that time point. So over the last 22 years, we've built a network called RAIN, Rheumatoid Arthritis Investigational Network, which has become known as the #1 clinical trial network for investigator-initiated research in rheumatic diseases, and particularly and specifically in rheumatoid arthritis. The RAIN network over the years has done a number of innovative clinical trials. One that really got us on the map was our trial that was published in the New England Journal in 1996. That was the first ever trial to show that combinations of therapies are the way to go when you treat rheumatic diseases. So that treatment has now become known as triple therapy or RAIN therapy, and it's used around the world, and it's the standard of care with regard to conventional therapies. Through the years, we try to focus all of our research on what's really important for patients to know. And okay, so what's a really important question at this point in the disease for a rheumatologist to be able to say, okay, based upon these data, we know that this is a great option for you. One of the things we excel here at the University of Nebraska about is clinical education. The people that we hire on our faculty here, we care that they're good teachers. We care that they can take care of patients. That makes my job as a residency program coordinator much easier because I have that faculty to work with. Through the years, we've built, by objective standards, the best internal medicine residency program in the country. We have a track record that goes back 14 years of 100% board pass rate. And we're the only program out of over 400 in the country to do that. Another very important aspect of how we do things here is we have a very close relationship with the VA hospital. And our division, partly through our role at the VA, is known around the country as kind of the site in the VA, again, for rheumatoid arthritis. Dr. Ted Michaels in our division has developed a registry for VA patients, and it includes about a dozen VAs across the country, and it's the biggest registry in the world for males with rheumatoid arthritis. One of the things that we have learned over the last decade is how important it is to identify the patient very early and to get disease-modifying therapy going very quickly. One of the exciting studies that we're involved with right now is actually finding rheumatoid arthritis before it happens. In this study, we're actually studying relatives of patients with rheumatoid arthritis, and because their antibodies changes and their blood work starts to change years before they develop rheumatoid arthritis. So now we're actually initiating a protocol to treat people before they have clinical rheumatoid arthritis. And as we learn from that cohort of patients in this trial, it's not too futuristic to think that a few years from now we may be identifying people before they even have a problem and getting a therapy going that hopefully will be a whole lot simpler at that point in time, and they'll never actually develop rheumatoid arthritis.